Josh is the Director of Policy and Projects for Mental Health Australia. He has an incredibly busy and influential role. I see him flying from one end of Australia to the other, talking to all manner of important people that I would also like to talk to. And he generously often opens doors for the state-based peaks to go and speak with those people on the national stage. And Josh has more recently been very busy writing the Mental Health Australia's response to the National Mental Health Commission, but he's also passionately interested in how the NDIS is going to roll out across the country. So I'm going to hand over now to Josh to give you a few words around the national perspective.
Do you mind if I move that, because I don't have a presentation? Just so I don't trip over the... They catch me falling over on the video.
Yeah.
Morning everyone, I'm going to be short and sweet and take up Kim's metaphor of the elephant. I'm going to pretend the NDIS is an elephant. And so I'm going to talk about that elephant's past, its present and its future. So how the elephant got to be here today, what the elephant's doing right now, and where it might wander off to at some point in the future. Just before I do, let me explain a little about Mental Health Australia's work on the NDIS. We're fortunate enough to have been funded by the National Disability Insurance Agency to conduct some capacity building work over the last 12 months, and we've just renewed our contract for another 2 years to do that work. But we also are highly conscious of the policy risks and the need for a strong voice from the mental health sector to government, and so we're engaged in a lot of advocacy, which I hope is visible from time to time if you're following our work. And I also wanted to make it clear before I start to say some things that might sound negative about the NDIS, that we see it as a major and historic opportunity to right the wrongs of the past by delivering choice and control to a group of people who haven't traditionally had choice and control over their lives, and to fill gaps in the service landscape that have been there for far too long. The opportunity of the NDIS is for a much larger proportion of total spending on mental health to be delivered through the community rather than in hospital settings, and that is the general direction that governments have agreed national mental health policy should be heading. And it's an opportunity to grow the community sector workforce, which has specialist skills that often go unrecognised at the moment. So there are, and indeed, just another major opportunity here, I guess, is a lifelong recognition of supporting someone's needs over a long period, rather than expecting that someone will be lumped with the service that's available in their area and they can take it or leave it. This is on an insurance basis. When someone enters the NDIS, the lifetime cost of that care is significant, and that presents a major opportunity for ongoing resourcing of the sector, and acknowledging that people have needs that last over a lifetime. So, how did the elephant get to be here today? Having seen how little progress we're making on policy challenges that were clear to us before the scheme even began to be rolled out, I've started thinking about that as a political failure, which is that government set in train a bunch of processes which were not fit for purpose. So, for example, we have a system of, you might call it diffuse accountability by governments, because 9 different governments share responsibility for the architecture of the scheme, the broad parameters that the scheme is going to be rolled out through, and and for funding the scheme. And whenever COAG needs to make a decision, you know it's going to take a long time. And in the meantime, we have real people on the ground in trial sites missing out on services because key decisions haven't been made by government. So that's one of the political failures, and I think the other notable one was rushing the scheme 12 months ahead of schedule, which meant that major decisions about scheme design weren't arrived at. And in particular, there was a deliberate decision that mental health was a special case, but the minority of participants, and therefore could be left until later. And that's unfortunate, and again we're seeing the ramifications playing out today. Yeah.
Sorry to interrupt, it's almost impossible to hear you up the back.
Oh, really?
Chance you could speak up or get the microphone a bit closer.
Should I get shouty? Is that better?
Much better.
Okay. We've had hundreds of conversations with people in trial sites and people who are also having similar conversations in trial sites. And it seems to us from a national perspective that the Victorian situation is the worst case scenario right now. But I think it's worth appreciating that the NDIA are taking this build and learn approach, and one hopes that if the lessons of Victoria are learnt, that the scheme come full rollout won't look like it does in Barwon today. There are much more positive stories coming out of the Hunter trial site and the Perth Hills trial site. People receiving services they didn't have access to before, people who have not even been accessing the system finally receiving the help they need. But at the same time, there are all sorts of implementation problems which I put down to that rushed implementation timetable. The NDIA had to get a workforce up and running to get people into the scheme as quickly as possible to meet the targets that government was setting. And all sorts of decisions needed to be made in haste, and sometimes they haven't been made well and sometimes they have. I guess one of the common themes we've heard about is key people being excluded from discussions about someone's needs, and in particular carers and service providers with a trusting relationship with a participant have been seen to have a conflict of interest rather than a confluence of interest with the participant. And so that's been unfortunate, and hopefully again that can be one of the lessons learned. So where's the elephant at the moment? What's the elephant doing right now to fix some of these problems, to resolve some of these uncertainties? There was a report delivered to the NDIA board by KPMG a few months back. It made my brain hurt because it was written in management consultant waffle, but from what I could piece together, what it was saying is we have a scheme that whose broad design parameters haven't been set yet, and that is the biggest risk to the scheme's future. And that before we proceed too quickly with implementing the scheme, we need to get the architecture right. And that's just a different way of saying, I guess, the same thing that many of us in mental health land have been saying since before implementation, that we don't know what Tier 2 looks like, for example. So how do we know whether Tier 3 is going to meet the needs of the population it's intended to serve? Based on that advice, I'm pretty confident there's a lot of work going on in the NDIA to solve some key aspects of scheme design. I'll just mention a few of them. What does Tier 2 look like? Is it an expanded system of services and support? Or is it, as the Productivity Commission first envisaged, just an information and referral service to other systems? what supported accommodation will be available and resourced through the NDIS? Where are the system boundaries? It's easy enough to say, well, this is the clinical issues are the responsibility of the health system, and non-clinical issues are the responsibility of the NDIS. But in practice, obviously, it's much more difficult to draw that fine line and say this one's that system and this one's another system. And something we've been talking to the NDIA recently about is better describing what psychosocial support looks like, so that community mental health NGOs can actually see their work in the pricing, the support items published in each trial site. Because the feedback we've had is they often don't recognise themselves in those support items. So more information will come on that hopefully soon. We're also our capacity building work. So I'm moving from what the NDIA is doing to what Mental Health Australia is doing. We're looking to build capacity or assist in building capacity to the extent we're resourced to do so for consumers and carers, and critically getting consumers and carers who can help others to negotiate the complexities is a big focus of our work. Building the capacity of providers through events like today, and building the capacity of the sector as a whole to operate in a new funding environment. So, for example, we're looking at what kinds of data systems that organisations are going to need in the future when they're asked to report in a very different way on their activity. But beyond the capacity building work, there's an advocacy task that Mental Health Australia is keenly aware of. And in a couple of weeks' time, we'll be publicly launching what we're calling our needs assessment for the mental health sector. And that has specific recommendations about very many aspects of the scheme, and going far beyond the NDIA's purview, which is implementation, and looking at the policy changes that are needed to make the scheme work. And I think it's safe to say that at some point over the next few months, Mental Health Australia is going to attempt to lead a campaign in the sector on the continuity of service guarantee. So for those of you who haven't read the bilateral agreements between the Commonwealth and the states, each government has committed to continuing to fund services that existed just prior to the scheme, so that no one misses out in transition. In practice on the ground today, that's not occurring, and we need to follow up on what governments have already committed to, and we'll be in touch through VICSERV with more information on that.
What does that mean for Victoria? What are they committed to continue?
They said that people who receive a certain service today should continue to receive that service up until 2018-19 when we're in full transition. So where's the elephant heading? Where's it wandering off to? I can see the worst case scenario in the future is that some of the arrangements in those bilateral agreements continue, that we have a Tier 2 system meant to underpin Tier 3, which is underdeveloped and doesn't really serve the needs of that much larger population of people with mental illness who have needs that are more than clinical. And we see additional service gaps opening up because of the way these scheme design issues are played out. On the other hand, the best case scenario, I think, is that these scheme design issues are resolved, that we have a Tier 2 system that allows for growth in the community sector, that the NDIS actually helps to address the existing service gaps that we have, and therefore that we have a better integrated mental health system as broadly conceived. And that would be a good outcome. And I think the way we're going to get to the best case scenario and avoid the worst case scenario is advocacy. This is essentially a small p political problem that requires a lot of people saying the same thing, which is that we need to get these issues sorted and that the work hasn't yet been done to envisage a scheme that can actually meet the needs of people with mental illness through the community sector. That's it from me. Thanks, Kim.